Welcome to the story. I am Dan Haggerty. So no flashy music, no jokes, nothing like that off the top tonight because we want to get right to some serious business. It all stems from this news release that just came into the newsroom no more than 30 minutes ago or so. And it is from the Oregon Health Authority saying that basically we may have our first coronavirus case in Oregon now. We're expecting a news conference they have at 6 o'clock. I don't know if you're looking at your watch, but we usually start this show a couple minutes before that. So I don't know how prompt it's going to be, but as far as what this says, it's pretty brief. It says, press conference today, state officials announce Oregon's first presumptive case of novel coronavirus COVID-19. So it's pretty brief. We do know that there are going to be a bunch of people at this news conference who can hopefully answer all the questions that are rattling around in your mind right now. Governor Brown is going to be there. The director of OHA will be there. They're going to have some doctors there as well, probably to talk to some of the reporters who we have there. Mike Benner from KGW is going to be there asking questions. Our cameras are there. I'm sure every news station in town is going to have a reporter ready to ask questions about this. Of course, this would be the very first case here in Oregon, but we wouldn't be the first state to suffer from this virus that we have seen spread around the world that started in Wuhan, China. As of right now, we, of course, have been reporting for a while about the one person from Washington who came here after being in Wuhan and tested positive for coronavirus, was put into quarantine. But since then, Washington has been monitoring hundreds of people who could potentially have the virus. We know from some reporting that we did a little earlier this week that Oregon was monitoring 76 people as of February 25th. Two of them had traveled to China in the last 2 weeks. As you see, we're popping up now the empty podium that we hope is filled soon by some officials. Some people here can answer these questions because this, I think, was the thing that everybody thought was inevitable, but was still a little scary, only because a lot of the information isn't quite known about this yet. We've seen a lot of misinformation being shared online. So this is going to be the stuff. These are going to be the questions that are going to be answered directly by the professionals and the people who know best. As far as the number of cases nationwide, we can take a look right now at what we know. The CDC has 62 cases in the U.S. Oregon monitoring, as I mentioned, 76 people here. Two of those Oregonians tested negative. So they were tested and they tested negative for coronavirus, this COVID-19. China, of course, where this all started in Wuhan, which is a massive city of like 10 million people, 78,000 people have been infected and roughly 3,000 people have died. There have been outbreaks, though, in several other countries following what we've seen happen in China, and it's really the fear that I think people have here in the United States because they do not want to see anything close to what we're witnessing in China and in some other countries now like South Korea and Italy. And in fact, there have been, travel recommendations made at this point for people not to make any non-essential travel to places like Italy. As far as the rest of the country and where we're starting to see these cases pop up. California, for instance, 11 cases total there, two of which, and this is another part that people have been thinking a lot about, two of those cases were not people who have traveled to China. These are people who caught this virus while being here in the United States. Again, Washington having one case, Wisconsin has a case, Texas has one, Arizona, there are two in Illinois, Massachusetts has one, 44 passengers on that Diamond Princess cruise ship that docked in Japan after the outbreak and quarantine there. But you have to keep in mind, we also have a person from our local area who was on that ship as well, who is recovering from coronavirus. Of course, we said this was supposed to start right at 6 o'clock. They're apparently not quite ready. We are ready, though. For the time being, we're going to move on right now from this coronavirus coverage. But again, we'll come back to it wherever we are in the show when they're ready to talk. So let's take a quick break from it. Let's talk about some of the other things we have planned for you here on the story, and we'll start talking about this presumptive case now in Oregon of the coronavirus. So meantime, we want to talk about a 3-year-old story that we learned today is far from over. It's a story of a young black teenager shot and killed by Portland police in 2017. You might recognize the name, Quantis Hayes. Now, his death was ruled justified by a grand jury. Police suspected Hayes for robbery. It was during the arrest they said that he reached for his waistband. After the shooting, they said they found the replica gun you saw there nearby. But Hayes' family, they say the officer was being unreasonable when he shot Quantis 3 times with an AR-15, so they sued the city. Well, now things are starting to bubble up again, and it's stemming from something that the city attorney said back in December. He made this argument that Hayes and his mother were ultimately responsible for his death. Hayes, because he allegedly committed the crimes and carried that fake weapon, and his mom was to blame because her 17-year-old son wasn't living at home. Well, now 4 candidates for Portland City Council are demanding the city withdraw that argument in a joint statement letter that they sent to the current sitting city council members. And that brings us to tonight's quote of the day from that letter. Loretta Smith, Sarah Iannarone, Carmen Rubio, and Sam Adams all weighing in on this, all saying, quote, that argument is disgusting, oppressive, and polarizing. The candidates also want the city to work with the Hayes family to resolve this case, though we're not really quite sure how they're defining that phrase, resolve this case. We wanted to hear from the mayor on this and the rest of city council, so we reached out. We got a response of no comment from Mayor Wheeler and Chloe Eudaly, no response from Joanne Hardesty or from Amanda Fritz, who is currently out of the country. But we will, of course, keep asking. All right, if you are like us, you're probably keeping track of the Republican walkout. It's now day 5 right now over cap and trade. Last night, Democrats voted to subpoena House Republicans to try and get them to come back to the Capitol. Now, it requires them to appear before the Rules Committee next week to explain their absence. So what does it all mean? How does it all work? Well, Democrats actually hired a private company to track down Republicans and serve them the subpoenas in person. No one really quite knows where all the Republicans are right now. In fact, it kind of sounds like a few of them did in fact leave the state. If Republicans refuse to comply, Democrats can take them to court. Now, the court can then order them to show up at the Capitol if they don't obey. That is considered contempt of court. And in theory, I guess they could be fined or really even put in jail. But Republicans, they say they can fight this entire process, and it's something that they might use here as an argument. Article 4, Section 9 of the Oregon Constitution says lawmakers shall not be subject to any civil process during the session of the Legislative Assembly. Basically, what that means is they can't be sued or have any legal action taken against them during the session. By the way, Republicans have not said if they plan to comply with the subpoenas or ignore them, but they have criticized Democrats for using, quote, strong-arm tactics and say they won't be intimidated. So we got a question from Carol Stadio, and we've actually heard this from a lot of people wondering this as well. She asked, is it legal for politicians to keep sending me texts? I never signed up for them, but according to this person sending them, they got my number from the Oregon registration database, so that makes it legal. So if you're not sure what Carol is really talking about here, we'll tell you. Political campaigns, they're sending texts to voters and they're asking for support. Bernie Sanders' campaign is doing it a lot, but there are also some local people doing it as well. Carol got a text from Jamie McLeod Skinner's campaign for Oregon Secretary of State. So to answer your question, yes, frankly, it is legal. The FCC regulates automated robo-text, but that's not what these are. Campaign staffers are volunteering to do this, and they're individually sending these text messages, so it makes it totally legal. How'd they get your number, you're probably wondering? Well, the Democratic National Committee buys huge lists of cell phone numbers for voters in every state, and then they give them to the campaigns. And again, this is totally legal. If you want them to stop, campaigns say that's pretty simple. You just reply unsubscribe or stop. So kids have the boy who cried wolf. Portland has plans for Wapato jail. It was a jail, then it wasn't. Then it was going to be a homeless shelter, then it wasn't. Then it was going to be demolished, then it wasn't. For what it's worth, the nonprofit does plan to announce tomorrow that it has raised $4 million to turn the jail into a homeless shelter. Helping Hands Reentry Outreach Centers hopes to transform Wapato Jail into the Bybee Lakes Hope Center, and that $4 million would go toward basic operations for 2 years and furnishing. Now keep in mind, it is incredibly expensive to run this facility and to maintain it, even when it's just sitting there doing nothing.
Wapato. It's the jail that never was, but it keeps trying to be something else. So how did we get here? In 1996, voters okayed a $46 million bond to build Wapato, and the state threw in $12 million more. Great, right? Well, except for on that same exact ballot, voters chose to make it hard for the county to raise the money it needed to run the place. Not off to a great start. In 2003, they went ahead and they built it anyway and immediately put it to use. No, that's not at all what they did. It sat empty, costing us between $300,000 and $400,000 a day just to keep it open. In 2015, the mayor at the time, Charlie Hales, declared our housing emergency, and that's when Wapato entered the homeless shelter discussion. But the city decided it would cost too much to convert it. So in April of 2018, the county voted to sell the $58 million jail for $5 million, a $53 million loss. Last October, its current owner, Jordan Schnitzer, discussed demolishing it until this January, when Hands Reentry Outreach Center started campaigning to change Wapato Jail into Bybee Lake's Hope Center. Which brings us to today, when that group said they've raised $4 million for the effort. Whew! And that's how we got here. When the story continues, how did one of Oregon's best chances at a gold medal get started as a runner?
She promised to take me to McDonald's afterwards.
I guess that works. And we're learning the science behind leap year. But first,
we have how many days?
264. 360.
I guess we gotta go back to the basics. And keeping Portland weird and horizontal.
All right, welcome back to the story. Dan Haggerty here to get you back up to speed here. The state of Oregon now announcing the first presumptive case of coronavirus here in Oregon. We're expecting a news conference any minute. In fact, about 5 minutes ago, we got a 10-minute warning. So in about 5 minutes, we are expecting the governor, the head of OHA, and some doctors to take the podium and start talking to us about this development. If that happens, we are going to take it immediately, even if we're in the middle of a story. So stick with us, and we'll keep you up to date on that. Meanwhile, we want to welcome you back. Thank you for all the comments and the emails we're getting, the tweets using hashtag HeyDan. Keep those questions coming, and I assume you're going to have a ton of them after we take this press conference here, so keep that going. We're going to read some of them a little bit later. We might keep a few in our back pocket as well, because we get a lot of great story ideas from you guys. So speaking of a good story, how about this one? We want to tell you about an Oregon athlete. He's already the greatest American distance runner of his generation, but there is one thing still eluding Galen Rupp, and that's a gold medal. His quest to win one in Tokyo starts tomorrow. The marathon trials are in Atlanta, and he will be there as the heavy favorite to win. The past year, though, and a half has been maybe the most challenging of his career, with injuries and having to find a new coach. I got a chance to sit down, talk one-on-one with Galen for a while, and find out how he's doing.
Galen Rupp was born to run, or should I say, born to a runner, and a mother who loved the outdoors.
For the longest time, she always trying to get me to run in the park with her, Mount Tabor, right where I grew up, and took her a long time, and eventually she convinced me because she promised to take me to McDonald's afterwards.
Galen followed in her footsteps, you could say. He dominated at Central Catholic and Oregon.
Do you consider yourself more of an alum of Central Catholic or U of O?
Both. I don't know.
No, come on. You can't. I knew you were going to say that.
It's tough, yeah. I loved them both. I'm a proud duck and a proud ram.
Rupp made his first Olympic team in 2012 and won silver in the 10,000 in London. He then transitioned into a marathon runner, winning bronze in Rio. And while people like Rupp can often make it look easy, it was anything but.
On the Olympics in Rio, I was hurting pretty bad for the last 6 miles, and I started out saying, all right, just concentrate on getting to the next water station. Don't worry about how long you have to go. And then that started to get too long for me, and it got to the point where I was counting light posts. I mean, literally just saying, run, make sure you get to the next light post. I was in 3rd place in the Olympics, and I wanted to stop.
Rupp goes into Tokyo as one of the favorites, but is entering the games after some of the most challenging years of his career. He had surgery in 2018 for an Achilles injury and admits he came back too soon for the 2019 Chicago Marathon, a race he never finished.
In Chicago, I kind of circled that date the second I decided to have the operation and go in as what I was going to point for to come back. And probably a little bit of hard-headedness on my part that, I decided to run it. But yeah, my body just wasn't ready for it. I mean, and I tried as hard as I could.
Rupp also has a new coach after his longtime coach, Alberto Salazar, got a 4-year ban for doping-related violations.
I've followed the water rules, with that, so I don't really have a lot of contact with them. It doesn't change what I'm trying to do for Tokyo and getting ready for the marathon trials.
I asked Rupp about his past accomplishments, but he didn't seem as interested to share them as I did to hear them. He seems more focused on the finish lines ahead of him and his motivation to get there.
I've got 5-year-old twins, a 3-year-old, and he's almost 1. But I always thought it'd be pretty cool, if they could just actually have some memories of what I do or be able to understand a little bit. So it's keeping me going a lot right now and giving me a lot of motivation.
So I got to talk to Galen for about a half an hour. It really was a great conversation, I think. So it was a lot of fun. As you mentioned, he has twins. I have twins. So we had a lot to chat about. You can watch it on our YouTube channel right now. Now, Galen isn't the only duck to be in the only duck in the race here. Jordan Hasse has a chance to make the team in the women's side. Hasse was also a member of Alberto Salazar's Nike Oregon project and had to find a new coach. Hasse finished third in the Boston Marathon last year. She's now training out of her hometown, San Luis Obispo, California. If she finishes in the top 3, she'll make it to the Olympic team. Good luck to her. We wish Jordan and Galen the best of luck. We're rooting for you, of course. You can watch the marathon trials right here on KGW tomorrow morning at 9 o'clock. So today we had kind of a crazy story. It involves a goat, a group home in Northeast Portland, and a 911 call. Dateline Dan takes it from here.
911, what is the location of your emergency?
They invited him into their home.
We got a goat in our house.
But things took a bad turn.
It's trying to headbutt me and everything. I live in a group home. We need police to help wrangle a goat.
Terrified residents barricaded themselves into a room when their guest
I never wrangled a goat in my life before.
turned on their gracious hosts and charged.
Gonna get out there as soon as they can, so just keep yourself safe.
Heroic Portland police officers arrived, earned its trust, and turned it in to Rossi Farms. For the story, I'm Dateline Dan Haggerty. How'd you like to know the science behind leap
A
year?
little bit, yeah.
I think so.
I guess.
Sure.
Well, good, because Drew's going to help us out when the story continues.
You're probably wondering why we're still on the air right now. It's because we're expecting that news conference at this point. So let's go ahead and send it right now to OHA, the governor, and some doctors to talk about this first presumed case of the coronavirus. We're waiting to get that picture up for just one moment.
Communications officer here at the Oregon Health Authority. We're here to provide you an update on the state's coronavirus, novel coronavirus COVID-19 situation. And we have Governor Kate Brown. We have Pat Allen, Director of the Oregon Health Authority. We have Jennifer Vines, Dr. Jennifer Vines, Tri-County Health Officer, and Dr. Dean Seidlinger, who is Health Officer and State Epidemiologist. Governor?
Thank you.
Yep.
Good afternoon, everyone. Thank you for being here this evening. This afternoon, we learned that we have Oregon's first case of the COVID-19 coronavirus. Earlier this week, federal health officials advised Americans that new cases of the COVID-19 coronavirus were likely to occur. That is why I directed my agencies to continue more active preparations. And that's why today I stood up a coronavirus response team to coordinate these efforts statewide. I understand that this news is concerning. However, I want to reassure you that our state and local authorities are responding quickly to the case. They are professionally trained to handle this situation. Oregonians should know that we are taking this very seriously. Officials will provide immediate updates as we have them. With that, I'll invite Oregon Health Authority Director Pat Allen to give more specifics and what next steps our health professionals are taking. Thank you very much.
Thank you, Governor. First, I want to acknowledge that there has been a great deal of concern around the world and here in Oregon about the COVID-19 coronavirus, and that concern is real and reasonable. As the Governor indicated, we've had our first presumptive case of COVID-19 in Oregon. What does that mean? That means that the individual who was under investigation had a test done, and that test was returned positive. That test was done by the Public Health Laboratory here in Hillsborough. Earlier today, we were doing a variety of briefings about our preparedness, and at that time, that capability wasn't yet online. It actually came online during the day today, and so it was able to be deployed and provide that test. We'll do a confirmation test through the Centers for Disease Control and Prevention in Atlanta, and so the case will be considered presumptive until we receive a confirmation one way or the other. The case is from Washington County, and the individual is currently at Kaiser Permanente Westside Hospital. In the interest of privacy, we will not be disclosing the age, gender, or specific condition of the individual. Nevertheless, our concern is certainly with that person and with that person's family, and we want to provide all the support that we can for them. There was no known travel exposure for this individual, so this is a case of community spread of the disease, much like the case from California earlier this week. The patient has spent time at the Lake Oswego School District at Forest Hills Elementary School. We're working with the local school officials and the Oregon Department of Education in the response. We're also working with Washington County and Clackamas County public health authorities to conduct contact tracing to notify people they may have been in contact and offer health guidance. We're also providing guidance to local healthcare providers to help them respond to inquiries they may expect to get from parents and other community members. We've notified the Centers for Disease Control and Prevention and are working closely with all of our local partners. What we don't know. We don't know the number of close contacts being within 6 feet for a prolonged period of time that this individual had. We don't know how this person became infected with COVID-19. It's too soon to say what impact this case has on family, friends, coworkers, or the Lake Oswego School District and other members of the community. Contact tracing is our top priority right now. We'll notify the public as soon as we receive any information about potential exposures. What are we doing? We will notify anyone who is likely to have been exposed. We're continuing to process COVID-19 tests as necessary at the Oregon State Public Health Lab. Earlier today, we identified that there were 2 individuals under investigation, and so we're testing that other individual. We will announce any individual positive test results when we become aware of them. What can you do? The advice is actually pretty simple and has been around for a long time. Cover your cough and sneeze. Wash your hands. If you begin to have symptoms of a cold or flu, it's critically important that you not go to school or go to work. Stay home and call your healthcare provider for guidance. And stay informed. The OHA website healthoregon.org/coronavirus has a variety of information pieces for individuals and providers. And the 211 information line is equipped with information to answer inquiries that you might have. We spent a lot of time today at the Capitol and talking with you all about preparedness for this event. We've been expecting this and we're prepared for it, and we're using the system that we described today to respond and help keep Oregonians safe. Now I'd like to turn it over to Dr. Vines.
Good evening, everyone. I'm Dr. Jennifer Vines. I'm a family physician, and I'm the lead for the Tri-County Health Officer Program. That's Multnomah, Clackamas, and Washington counties. I also want to acknowledge the seriousness of this first case. I want to let the family of this ill person know that our thoughts are with them, and I want to acknowledge the public concern that we've been planning for and working hard to address the last several weeks. I would also commend our colleagues at Kaiser Permanente for alerting us to this case and for treating this person and looking out for their frontline healthcare staff. So I would say that we are early in our investigation of this case. We are working tonight and through the weekend to determine where this person spent their time, who may have had close and prolonged contact with that person, and who will need health education to be on the watch for symptoms. We do know this person spent time at an elementary school in Clackamas County. We don't yet know exactly the risk of that the time there poses to those students, but my colleague, Dr. Sarah Present, the Clackamas County Health Officer, is here tonight. She's in direct touch with the school district, and they'll be announcing their next steps shortly. So this is your local and state public health system prepared and doing what we do, which is identification of cases, identifying people who may be exposed, and making sure they have the information they need to stay well and stay safe and keep the rest of us safe. So again, the things for all to do are cover those coughs and sneezes, wash your hands, and now is a good time, like ahead of any potential emergency, make sure that you have a plan for your family, that you have food, medicines, pet supplies for at least a couple of weeks, have a plan for childcare should you need it, and know what your employer's sick policies are so that you can stay home at the first sign of symptoms. So thanks. With that, I think, are we taking questions?
You guys might want to step up there. I guess, can you go over again this, so you're calling this person a Washington County citizen, is that correct, this individual?
Washington County resident.
But spent time at Forest Hills Elementary School in Lake Oswego?
That's correct. The person lives in Washington County and spent time in the Forest Hills Elementary School. We're trying not to be any more specific than that in the interest of patient privacy.
Can you say whether the person is an adult or a juvenile?
Yes, an adult.
And is this patient still currently at Kaiser?
I can't comment on their current treatment or health condition.
Hospitalized?
Yeah, they are still hospitalized.
And when you say presumptive case, is it presumptive until these tests come back from Atlanta?
Right. We're getting our positive test result confirmed. If the test comes back from Atlanta positive, then we'll stop calling it presumptive and say it's a positive case.
You're still waiting.
Right. But the guidance from CDC is we should treat a presumptive case as a case until we have any further information.
Can you differentiate between the term hospitalization and quarantine? This isn't a quarantine, this is a hospitalization?
Correct.
Can you say how long you expect it'll take to get those results back?
Very shortly. We're having them expedited, and it could be over the weekend, and we'll provide that information if it is.
So just to clarify, Forest Hills Elementary in Lake Oswego, spent time there, and then also an elementary in Clackamas County?
Forest Hills Elementary is in Clackamas County.
Okay.
Do you expect a Lake Oswego School District to come out publicly with some sort of plan tonight?
Yes.
This weekend?
Yes.
Okay. Obviously, since you guys sent the notice to us about this, social media, everyone getting anxious about all this. What do you tell them? I mean, people are obviously concerned.
Yeah. So, the concern is completely understandable. For most people who contract this disease, it's like any other coronavirus, where the disease itself is relatively mild. A small percentage of people will have a serious disease, and it could progress that way. The most important thing to do, as mundane as it sounds, is cover your cough and sneeze, wash your hands, and this helps demonstrate most critically. At the first sign that you have symptoms of a cold or the flu, you should stay home.
I want to add something. I just want to reassure Oregonians that we are taking this very, very seriously. I also want to encourage Oregonians to go about their daily lives, to stay calm, and as Pat and the doctors have mentioned, to take appropriate public health safety concerns, including covering your mouth when you cough or sneeze, using a tissue, washing your hands thoroughly, and if you're sick with the flu or a cold, to stay home from work or from school.
Governor, were you aware of this presumptive case when you announced the response team this morning, or is this kind of really new within the last couple of hours?
I was not. My team learned of this case at about 3 p.m. this afternoon.
Can you tell us, I know you're trying to keep the person's privacy, what city in Washington County they live in, or a general area?
Cannot.
Okay. Can you say any more about why they were at the school? Were they a parent, a teacher?
I'm sorry, we cannot.
Any idea how many people we're talking about that you are attempting to locate?
Dr. Vines.
Yeah. So I would say we are early in our investigation. We have people working on this literally as I speak, and we'll be working on it through the weekend to identify those who had close and prolonged contact with this person and may be at risk for transmission.
And you can't comment on how they're responding to this illness, what their condition is. Is it mild for them, or is it more serious?
For who's?
The patient.
Patient? No, we're not seeing anything other than hospitalized.
And once again, you said this is a community transmission event. Can you talk about what that means and how that is different from some of the other cases we've seen nationally?
Sure. So what we know so far is that this presumptive case does not have travel to any of the known affected areas in the world that have coronavirus transmission ongoing. That leads us to conclude that this person acquired this infection here somewhere in our community. So that's how we call it, presumably a community-acquired case.
So they didn't take a plane or anything like that?
As far as we know right now, that is correct.
So if they got this from the community, then do we assume someone in the community, there's someone else that has it? Or how does, right?
Right. So that's the question that we need to answer. And as we identify contacts, and in particular, as we identify people with close contact, ask them to watch for symptoms. If they develop symptoms, they would become candidates for testing, and we can start to get a better sense of how contagious this disease is and what is the range of symptoms that people have with this virus.
Do you think this is going to get a little more concerning before the latter? I mean, obviously there might be someone else, and then you mentioned a second patient. It looks like we might see an increase in numbers here.
I think that's possible, especially now that we have local testing capabilities, which is a real asset to our public health system, to have the state public health lab able to run this test. So the case count may very well tick up, and again, that's public health doing its job of confirming cases in people who've had a known exposure and who develop compatible symptoms.
Were you guys aware of the rumor circulating that somebody with coronavirus was at a Kaiser Permanente facility?
Is that from several days ago?
Several days ago, yes.
Yes, I was aware, and I helped dispel that rumor.
Well, now that we're hearing this, is that the case that people were talking about, or is this something completely different?
No.
Now that it's here, we had heard of a California case in Northern California where testing from the CDC wasn't being done as quickly as they would have liked. Has that ramped up? Have national officials reassured you that if we have new potential cases coming in, that they will be tested quickly, so maybe this can be isolated?
So just the Centers for Disease Control this week, after that case in California, did expand the number of people who would be tested. So the people with serious respiratory illness who are hospitalized, even without a travel exposure, are now being tested. And they've also committed to ramping up the state public health lab testing capability, which was able to come online today after it was being certified. So yes, the CDC is working to increase that capacity so that we are able to test the people that we're investigating who need that test, so we can confirm whether or not they have this new virus.
What about school closures or quarantining of entire communities? Is that something that is being looked at right now as far as where this patient is located?
Could you repeat the question for all?
Yeah. So the question is, what about the tools of school closures or other things that we could do to limit the spread? I think those are tools, as you've heard from us previously today, that we have in our toolbox to try and control a condition. The reason we have people working tonight and through the weekend to identify who this person has contact with, so we can try and draw a tight circle and see the people who are at risk, identify them, assess their symptoms, see if they need to be tested. If we do notice spread in our community or multiple cases, that is certainly something we would consider on a case-by-case basis if the situation escalates in Oregon.
How quickly can you ferret that out? Like, how, you've probably done this before with different illnesses. How quickly do you guys move? When will we know the amount of spread?
So when we know of a case, you will know shortly after us if we identify a case. We've been doing this continuously with our persons under monitoring who've come into Oregon, and already cleared about 180 of those people who did not develop symptoms and are now in our community with no threat at all. We have additional Oregonians who've been very compliant in working with our local public health officials and staying home, talking about their symptoms and reporting things. We've had 2 people prior to this who developed symptoms when they were under monitoring, were tested, and those came back negative. So we have the utmost confidence that people are complying and listening to public health. We know there's a lot of concern out there, and that's why we are announcing this case, even though we don't have all the information, because we want people to be assured that public health, the state, our federal partners, our local partners are working together to do everything we can to ensure people are protected.
I'm assuming this person is self-quarantining, or not self-quarantining, but they're in the hospital?
This person is in the hospital and is isolated.
What about the members of that you know have come in contact with them already? That you don't know if they have it, but have you asked them to kind of stay isolated?
Our Kaiser Permanente, our healthcare partners are working very hard on making sure that their staff are protected and taking the steps they need, and our local public health partners who are working with potential close contacts, including this individual's family, are also assessing to make sure that people are taking precautions and not exposing others.
Is there
concern over other areas in Washington County where this person could have spent time? I know you mentioned the school, but is there any other areas that you guys are looking into where this person could have spent time that is posing a risk to others?
So that's a great question. Part of the local public health response is to do a detailed timeline of where the person was during the period that we think they were most infectious. So again, that's happening literally as we speak, and we account for pretty much every minute of the day in an important potential exposure like this one. So again, we're looking more for close and prolonged contact, but we are making sure that we do our best to capture anyone who may be at risk and needs to know that they've been exposed.
And Dr. Vines, can you explain again the second person you guys are, is there another person that's being tested and you're waiting for those results to come back? You mentioned that you know that you don't want to talk about the second.
Yeah, so we committed to doing weekly updates, but since we're here, there's another individual who has developed symptoms and would fit criteria for testing by the CDC. Those results are currently pending, and if those results come back positive, we will certainly confirm those as soon as we have that. To confirm what Dr. Vines said, we work on these prolonged close contacts for these investigations to identify who's at risk. This is not like a measles investigation where even kind of being in the same room with someone or after someone would put you at risk. It does really require kind of being close, having a conversation. Passing someone on the street or in the store isn't going to put them at risk, so that's why we want to reassure Oregonians are safe, as Governor Brown said, and we will work to identify those individuals who had close contact with this person so that we can assure that those individuals are safe and are able to take the steps they need to protect themselves and their families.
Just to clarify, that second person you're waiting on those test results, they were in contact with this confirmed case?
There's no connection between these two.
Okay, sorry.
I just wanted to add real quickly that, and the governor mentioned this as well, you guys literally got information about this within hours of the time that we did, and we're committed throughout this, if there are subsequent cases, to continue to maintain as high a level of transparency as we can. That means there will be times where there are a whole bunch of questions that we can't answer about the individual, but we want you and we want the public to have information about positive cases as quickly as we can.
Mr. Allen, do you fully expect more cases to pop up in Oregon given this news today?
Well, I think the CDC has indicated that they think there will be widespread incidence of the disease, and I don't have any reason to disagree with that.
But also saying that right now you say that the exposure for people is low risk, that people should go about their lives, go places, do things.
Yeah, I might actually rely on Dr. Dean to comment on that a little bit, but this is not a disease like measles where the virus persists for long periods of time after someone's left. It requires close, prolonged contact, and that's a different circumstance than some diseases that we look at.
Dr. Dean, do you want to add anything to that?
Yeah, I think this is the conversations we have every flu season. You know, the reason we talk about people with flu staying home is one, so that they can recover, but two, the people that they work with or when they're in school, that they're sitting across from having conversations, those are the people most at risk. So if they separate themselves at home, they're not going to put other people at risk. Diseases have very different ease of transmission from one person to another. Something like measles is incredibly good at spreading from one person to another person, and that's why we identify public places, supermarkets, airports where people may have been, so that if people develop symptoms, they can take action. We also, in a disease like TB, we know it's very hard to spread from one person to another, so we usually have very limited people who are at risk. This is something in the spectrum between tuberculosis and measles, but really closer to tuberculosis. It requires someone to be within about 6 feet, that person be coughing or sneezing to have those particles affect the healthy person who's with them to get infected. Unfortunately, what we don't have with this disease is a vaccination to prevent it like we do with the flu. It is still not too late to get your flu shot, and we remind you that flu is still circulating in the community, so someone who develops these symptoms of fever and respiratory infections may have the flu, and there's something that they could have done to protect themselves and their family by getting that flu shot, so get your flu shots.
Governor, can I ask you, are you confident with what's going on nationally to address the coronavirus?
Look, at least the work, I am very confident about the work happening in Oregon. We've handled these situations before, the Ebola virus, the H1N1. We have very well-respected, trained public health professionals, and I'm confident both in terms of our ability to handle the situation in Oregon and that we have the resources needed. I just spoke with Senator Merkley about a half an hour ago. He is working with his Senate colleagues right now on legislation to provide states with additional resources to combat this virus. And so I look forward to seeing that work get done in Congress.
Maybe one more question? Two more questions. How about two more questions? How about no more questions?
We want to let you know you've been watching a news conference. You've probably paid attention to this closely. A lot of people are concerned. This is from the Oregon Health Authority. Governor Brown, the director of the Oregon Health Authority, and health officials telling us there is the first presumptive case of coronavirus in Oregon. They're calling it presumptive because they had it tested at the local lab in Hillsborough, tested positive. This individual tested positive for the COVID-19 virus, but they need to have it confirmed in Atlanta. They're sending that there. It should be back shortly. So that's why they're calling it presumptive. One person, let me tell you a little bit about it if you're just tuning in. This person lives in Washington County. They're not giving us the gender or age or condition of the person, though it is an adult. The person lives in Washington County but did spend time in Clackamas County at Forest Hills Elementary School. So now what they're doing is working to contact all of the people this person may have had contact with, and they say they'll be working through the weekend to do that. There is a second person that they're watching who has symptoms. They don't know if that person has coronavirus. They're doing the test now, so we'll let you know what we hear there. They're doing that right now. They don't know how many people this first person had contact with. Again, this is in Clackamas County. The person was there. This is something they're telling people to go about your lives, not to panic. And one of the things that we're trying to do here at KGW is separate fear from the facts and facts from the fear. So we have all of that for you on KGW.com. We have Mike Benner, who's been standing by listening to this. You might have heard him ask a lot of the questions. He's going to put together a complete story for you, and we'll have all that for you coming up at 11 o'clock. And for more coronavirus stories, just go to KGW.com, where you can look at separating the facts from the fear.